Assalamu alaikum everyone. I hope all of you are doing well. In this video I am going to talk about bronchiectasis, which is a respiratory system disorder. So bronchiectasis is a combination of two words. One is the bronchi, the other is ectasis. The bronchi is the airway and the ectasis is the enlargement. So it is the permanent abnormal dilatation or enlargement of the airway in which there is destruction of the bronchial wall along with chronic inflammation and loss of ciliary function. So there are four things in the definition of the bronchiectasis. One is the abnormal permanent dilatation, and there is destruction of the bronchial wall along with chronic inflammation and loss of ciliary function. So these four things are included in the definition of the bronchiectasis. Remember that the bronchiectasis is a permanent disorder and it cannot be cured, but we are giving antibiotic and other treatment for symptomatic relief. So in the definition there is chronic inflammation. So whenever there is chronic inflammation, there will be fibrosis, and whenever there is fibrosis, there is permanent damage to the part of the tissue occur where there is chronic inflammation. The other is loss of ciliary function. Whenever there is loss of ciliary function in the respiratory airway, there will be no clearance of the mucus. So the mucus will accumulate there. Now what are the causes of the bronchiectasis? The recurrent infection is one of the most important causes, and the recurrent infection may be due to airway obstruction. It may be due to immunodeficiency, it may be due to TB, it may be due to bronchopulmonary aspergillosis, which is the fungal infection. There is the cystic fibrosis, which is the most common cause of the bronchiectasis. And the third cause of the bronchiectasis is the primary ciliary dyskinesia, which may be a part of the syndrome, and in which the cilia cannot function well. As a result, the mucus are accumulated there. The fourth cause of the bronchiectasis is the autoimmune disorder, in which the immune system attack on the respiratory airway and cause the destruction of the walls of the respiratory airway and cause chronic inflammation there. So the autoimmune disease may be celiac, may be due to rheumatoid arthritis. Now what are the clinical features of the bronchiectasis? The chronic cough is there will be sputum production, but this sputum will be foul smelling. This sputum will be purulent, and this sputum will be foul smelling, which show the infection. The other is chest pain. This is the inflammation of the airway. There will be chest pain. Dyspnea. The dyspnea is due to obstruction of the airway due to the secretion, because there is loss of ciliary function which cannot clear the airway. Ectasis is the hemoptysis. There will be blood along with cough. So fourth clinical feature of the bronchiectasis is the recurrent or persistent pneumonia due to airway obstruction. Now, how to diagnose the bronchiectasis? The bronchiectasis is diagnosed by CT scan by pulmonary function test. The CT scan is the investigation of choice for the bronchiectasis, and the pulmonary function test which will show obstructive picture. There will be if EV1 to FVC ratio will be less than 70%. Maybe wheezes. So the chest ray are done in the bronchiectasis to exclude other causes of the chest infection, which may be pneumonia, pneumothorax, etc. The other is bronchoscopy, in which we directly see into the bronchi and see the pathology there, if there are any pathology. So now how to treat the bronchiectasis? The bronchiectasis treatment consists of two things. One is the antibiotic, the other is bronchial hygiene, but the bronchial hygiene is more important. So antibiotic we give it for the symptomatic relief to eradicate the infection, and the bronchial hygiene include the hydration. The other is chest physiotherapy. In the chest physiotherapy there are two things. One is the postural drainage, the other is the chest percussion, and these both procedures are used to clear the airway from the mucus. The other is inhaled bronchodilator, which will relieve the dyspnea symptom. So this was all about bronchiectasis. For more videos, subscribe, like and share. So thanks for watching the video.